understanding estrogen dosage and its effects.
Hello everyone, and welcome to our discussion on estrogen dosage and its impacts. Today we'll be delving into how the dosage of estrogen influences the onset and intensity of its effects. Hormones, such as estrogen, play a critical role in our bodies, and understanding how different dosages can influence our health is essential.
What is estrogen and what does it do?
Estrogen is a key female sex hormone, but it's present in everyone, regardless of sex. In females, it plays a vital role in sexual and reproductive development, controlling the growth of the uterine lining during the menstrual cycle and preparing the body for pregnancy. In both sexes, estrogen affects numerous physiological processes, including bone health, cardiovascular health, and brain function. However, the effects of estrogen are closely linked to its concentration in the body, which brings us to our main topic.
How does the dosage of estrogen affect onset of effects?
Estrogen's effects depend significantly on the dosage and timing of administration. Lower dosages tend to result in slower onset and less pronounced effects. For instance, if estrogen is used in hormonal therapy, a low dose might bring about desired changes gradually, over months or even years. Conversely, higher doses typically result in a more rapid onset of effects. However, this doesn't mean that higher is always better. Overdosage of estrogen can lead to a range of negative health effects, including increased risk of blood clots, stroke, and certain types of cancer.
How does the dosage of estrogen affect intensity of effects?
Similar to the onset of effects, the intensity of estrogen's effects is directly related to its dosage. A higher dosage generally leads to more pronounced effects. However, the relationship between dose and effect isn't necessarily linear. For instance, doubling the dose doesn't mean the effects will be twice as strong. It's also worth noting that individual bodies respond differently to estrogen, and various factors like genetics, overall health status, and the presence of other hormones can influence the hormone's impacts. Therefore, finding the right estrogen dose usually involves a personalized approach, under the supervision of a healthcare provider. In conclusion, the dosage of estrogen significantly impacts both the onset and intensity of its effects. Higher doses tend to have quicker and more intense impacts, while lower doses are associated with slower onset and less pronounced effects. However, it's essential to find a balance and avoid overdosage, which can lead to serious health risks. As always, individual needs and responses to hormones like estrogen are unique. Therefore, any adjustment in estrogen dosage should be done under the guidance of a healthcare professional. Thanks for joining us in this discussion, and we hope it has been helpful in understanding the role of estrogen and the importance of its correct dosage.